You are listening to the Mom to Mom podcast, hosted by Stephanie Sinclair, founder and owner of How to Mom. This podcast is meant to empower women and bring the community together through storytelling and education. During these episodes, you will hear stories of triumph, heartache, and hope. You will hear time-tested tips and tricks shared by mamas and women. You will hear a variety of birth stories that will resonate with all birthing families, advice from professionals who have dedicated their teachings to pregnancy, birth, and moms. Here, you will find encouragement, support, and community, because we are your community, and we are so happy to have you. Now, on to today's episode. Hello, you guys. I hope you're having a beautiful day. I am so honored and excited for you to be listening to today's episode. It is on a very important topic that I think as a society we need to have more often. I know that it is a topic that I often speak on a lot with clients, and we do here at How to Mom. So thanks so much for listening to the Mom to Mom podcast today. And I am excited to introduce you guys to a local therapist here in the Twin Cities. Kyler is on today's episode, and she is going to share some really, really important information with you today, really important signs and symptoms to watch for. And we are just going to have a conversation about the reality of mental health in pregnancy and in postpartum. And so let me just give a little intro into Kyler. Kyler owns Soteria Health and Soteria Coaching and Consulting. She is a licensed therapist who specializes in perinatal mental health and trauma. She is also a mom of two. And I know that I noted that she is local here in the Twin Cities, but most of her clinic offers virtual support. And so if you are a listener who is not local here in the Twin Cities, I want you to know that you are going to walk away with some really great information today, and also with a really great resource to have in your pocketbook. Kyler and her clinic, they are on our recommended resource page. I think it is so important, not only as a mom who has lots of mom friends, but also as a birth doula and a postpartum doula, to have these incredible resources to provide to families, because we talk a lot about being excited about welcoming baby, about all of the rainbow and unicorn conversations, but we are here at How to Mom to really talk about all aspects of becoming a mother and what that can look like. And mental health is a huge component in there. So thank you so much for joining us today, taking time. I know that you are a busy business owner and mom, so I just really appreciate you educating the listeners today and talking about such an important subject. So welcome.
Yeah, thanks for having me, Stephanie. I'm happy to be here.
Did I do okay on the introduction?
Did great.
Okay, awesome. I love it. So do you want to share with us a little bit about your educational background, also kind of your journey into owning your own business and really specializing in perinatal and postpartum mental health?
Yeah, absolutely. So I have a master's in social work. I'm a clinical social work. Like you mentioned, I'm a licensed therapist. And I started my career really thinking that I would specialize in trauma, which I do, but really got started with, graduated with a trauma certificate, and then did a lot of my work at Fraser, actually, which is a big name. And people know they specialize in neurodivergence. So I saw a lot of people, in that realm, and kind of the trauma person there. And then how I kind of got started in the perinatal world, as well as my own business, was really from my own journey. I had perinatal wasn't even on my radar until I got pregnant, which for most of us, it's not.
It's not.
Yeah. So I had my first kiddo actually a couple of weeks before the pandemic happened and everything shut down. So imagine being a first time mom and not having any social support, not knowing what the world is going to bring.
Right.
Um, was incredible. And I was fortunate to, that was just my normal. So I don't think that I really struggled too much, but gave me some really good perspective of what, moms in today's pandemic go through.
Well, and I can imagine even if there was not a diagnosis of perinatal disorder or depression or postpartum disorder or depression, that I think it's probably just being honest to say that most pandemic mamas probably walked away with some trauma, regardless of how your pregnancy, how your birth, how your postpartum time went. I can just imagine that there was some trauma there for all of you mamas who went through pregnancy and birth and potentially 2 or 3 babies through a pandemic.
Absolutely. And then the anxiety of not knowing what the world is going to look like and if your baby's going to get sick. And if they get sick, are they going to be okay? Right. That was our world almost more than 3 years ago now that we're still
Yeah.
living in.
Yeah, just insane. I say it's like
Yeah.
it's like, having children. It's like, I can't decide if those were like the longest years or the shortest. Like sometimes I say, did those years even happen?
Yeah, absolutely.
So tell me now into your journey about deciding to start your own business.
Mhm.
The courage that takes, as I know too well. But then how, having that ability to not only kind of set your own hours, right, as a working mom of two, but also how you're probably able to reach a lot more women and specialize in this area that there's just not a lot of out there in the therapist world.
Absolutely. So it's actually my journey with my second kiddo that really got me interested in the perinatal world. I had a lot of physical stuff. I had hyperemesis with that pregnancy. And
So
again, I was
tough.
really fortunate to not struggle with mental health, but I knew that like the possibility was very real. It was very there because, again, in a pandemic,
Mhm.
and then also having that physical stuff, work became hard, socializing became hard. And so, being the person that I am, I'm like, I need to go do something about this. So,
Yeah,
during that pregnancy, I got certified in perinatal mental health,
amazing.
um, and then had that kiddo. And then I was about 7-ish weeks postpartum when I was like, I can't go back to the job that I was at.
Mhm.
I have to do something more because these kids are only little ones and I didn't want to miss anything.
Mhm.
And so I started my own business, quit the job that I had been at for almost 7 years. It's a lot. And
Scariest yet most thrilling decision.
it was terrifying. Yes.
Yes, I'm with
My
you.
husband thought I was a little crazy, I'm sure.
Mhm.
Um, but it's also been one of the best decisions, not only for me personally as a mom of two, but also professionally because I've been able to really support the people that I really enjoy supporting the most. So, people in pregnancy, postpartum, kind of that realm, and then also people that have experienced trauma inside and outside of that period as well. So it's been a
Yeah.
journey.
Well, and I often refer to How to Mom as my fourth child. I mean, to have such a passion and a drive to really want to make a difference and help in whatever area the listeners might have placed on their heart. Of course, this journey in owning your own business, it is not easy. There are definitely days that are challenging, but I often refer to it as being just like motherhood, right? Like there are days where I feel like I have it all together and there are days where I really struggle. But to have such a passion and such a drive um, to help others and the fact that that was placed on your heart kind of through your own journey, like that's what keeps you going. And that's what helps, right? When we make those really scary choices, we're like, okay, head down, always remember your why. Like it is worth it. So Quick question about our listeners, for our listeners, if they're experiencing different signs or symptoms, and we'll get into that, but what are the next steps to getting in touch with you? How do they go about doing that?
Yeah, so our website has a lot of that good information to contact our clinic. We have a contact form, goes right to me currently. And so they can, send us an email or fill out that contact form. We do offer free 15-minute consultations really to just see, if our clinic is even a good fit. And then also to kind of triage and see like, are you really needing help right now? Can we provide that? And then also if we're not a good fit, finding someone else that is. So it's a no obligation consultation that really is just meant to help fill some of that gap that really exists.
All right, you guys, we're just going to take a brief break so that I can tell you all about one of How To Mom's favorite go-to brands and products. Earth Mama Organics formulates and creates organic and natural herbal pregnancy, postpartum, breastfeeding, and baby care products. We believe that they are one of the best and the safest personal care products on the market for both you and for baby. You can follow the link in our bio, or you can go to howtomom.com/links, follow the Earth Mama Organics link, and enter How To Mom for your promotional code to receive 15% off. All right, now back to today's show. Awesome. Thanks so much for answering that question. And I think often people are hesitant to reach out because, one, they are questioning if they need the help. What are the signs and symptoms and things that women, and I think more importantly, their significant others and their support, what are the things that they can look for to kind of help? Sorry, scratch that. Awesome. Thanks so much for answering that question. That's really helpful. I think a lot of times women are hesitant because they're unsure if they're going to be able to find the right fit. And I love when we can offer those free consults because it kind of breaks the wall down and it says, let's just see if this is the right fit. And I think with any decision that we make as moms, like your gut, your intuition is going to lead you. And so what is there really to lose to kind of pick up the phone and just see if that potential connection is there? And it might feel like a huge weight is lifted off your shoulders just by jumping on that call. But what I think is really important to talk about as well, if you could give our listeners some insight into what are some signs and symptoms that they can look for, but even better yet, what are some signs and symptoms that they can let their significant other know about, or maybe mothers or their mother-in-laws or whoever their support system is? What are some signs and symptoms to really help us understand, are we dealing with some mental health that deserves and needs support?
Yeah, absolutely. And that's such an important question. And I think a topic that doesn't get talked about enough. A lot of people, there's a big misconception that people that go to like OBs or something like that, that if they're struggling, their OB will catch it. They won't because they're not trained in it. Sometimes they will. There are definitely more screening happening, but don't rely on the other people. They might miss it, and that's not their fault.
Right.
And it is so hard because your whole life changes when you have a baby, whether it's your first baby, your fourth baby, your eighth baby. Your life changes. You're going to be sleep deprived. You are not going to be your best self. And so a lot of times people even miss it too. I hear from moms all day that they're like, oh yeah, I've been dealing with this for months and months and months. And sometimes it's because, part of it is that wall that you mentioned. So, it takes a lot of courage to reach out to someone and say, things aren't going well. I need help. But also because they just don't know. Like, I just thought life was supposed to be like this.
Well, and I feel like that's so hard because sometimes we turn that into almost a reflection of ourselves. Like, if I'm struggling, if I'm having a hard time, if I'm having these thoughts, if I'm having these feelings, what am I doing wrong? Like, am I just not able to handle the hard? And also being able to decipher that, yes, your life changes, and yes, you're not getting the same amount of sleep, but at what point is it not about the hard and it's actual mental health that needs the support and care? And I feel like as a society, we have done better about having the conversation and normalizing mental health in pregnancy and in postpartum, where I feel like we continue to fall short. And I'm sure I'm even guilty of this. I know for sure my village, love them dearly. We all fell a little short when I was home with the twins. It's like, what's the next step then? It's like, yes, we can identify that there's a problem. And I'm going to share just a tiny little snippet of kind of a look into what postpartum looked like for me with the twins. And I feel like this might touch or relate with one of the listeners. But the best way I could describe how I was feeling, which I didn't realize was some postpartum anxiety and depression, was I felt like I was in the deep end of a pool and I could not keep my head above water. Every once in a while, somebody would throw me a floaty, and it would be enough time for me to catch my breath, to try and reset, reground. But then I would continue, that floaty would get taken away and I would continue to struggle keeping my head above water. And this is going to sound crazy, but I remember just saying, I want somebody to take me out of the damn pool.
Yes.
Like, that was the best way I could describe how I was feeling. And I had some really amazing people in my life to listen to that. But then there was never the next step. And so if you could kind of talk about signs and symptoms, and then if we're seeing those within ourselves, or, if a support person is seeing that, what's the next step that they can do? Because I know it was really hard for me to acknowledge and say, okay, I need to now reach out, because I was like, I'm already overwhelmed. So what are the things after we, see these signs or these symptoms? What are the things that we can do to help get that mom the help that she deserves?
Yeah. So in a perfect world, people would find out that they're pregnant and they would call their OB or their midwife, their doula, and a therapist
Mm-hmm.
from
Yes.
the beginning.
Yes.
And a lot of people are like, why would you do that? I'm not struggling. I just found out I'm pregnant. Maybe I'm nauseous, but everything's fine.
Mm-hmm.
Because of that exact reason, therapists are trained to recognize these things, right? We can differentiate between like sleep deprivation because you have a newborn and sleep deprivation because you're feeling anxious and can't fall asleep. And so it's really important, again, in a perfect world, to have that relationship during pregnancy, even if it's just you go a handful of times to build that relationship and vent about your pregnancy symptoms.
Mm-hmm.
Great.
100%.
Because pregnancy is hard, right?
Yes.
Even if it goes 1000% according to plan, it is hard. And then you already have that person in your back pocket. Because what we run into a lot is people wait months and months and months, like I mentioned, to get help because they either don't recognize it or they feel like they're failing in some way as a mom, as a spouse, as a person. And to reach out to a complete stranger and to admit that is really difficult, because that means I feel like I'm failing and I'm telling someone else that I'm failing. So I really must be failing, which isn't true, but it happens. So signs and symptoms, important ones are difficulty sleeping, which again, hard because you have a newborn and you're not going to sleep well anyway. But if you're not being able to fall asleep, if you're constantly feeling like worried about your baby or checking on your baby, if you have to wash the bottles 8 times because they're not clean enough for your baby, those are all really big signs. If you're ever, thinking about harming yourself for your baby in any way, does not mean you're failing. Just means that you need help. And those would be big signs. And then just kind of irritability. We see that a lot in partners, strong irritability or checking out. So a lot of times in today's day, like scrolling on Facebook a lot because you just can't deal with the here and now. Those are some really big ones that I would say are pretty common. In addition, just want to throw out there, if anyone is ever like seeing or hearing things that aren't there, go to the emergency room. That's a big thing. You need help right away.
Yeah.
Versus the other ones that I mentioned are really things that you definitely need help, but they can wait a day or two or a week, however long it takes you.
Yeah, absolutely.
And then you asked about how to get help, which is a really great question. So my clinic is just one, right? There are lots of therapists out there that specialize in this, and the How to Mom directory is a really great resource.
Thank you.
Yeah, and then
I really try to constantly add resources there and but also keeping it, local and small enough because that overwhelm is so easy to get to in parenting. And so, yeah, I'm really proud of that resource directory. And you were such a great addition because I feel like it's accessible, and it's not overwhelming, and it really focuses on the needs, around moms.
Yeah. And another great resource is just postpartum.net. So that is Postpartum Support International's website. And on there, they have not only a directory of therapists and psychiatrists that specialize, that have gone through certification in this area, but they also have a lot of different free online support groups. So support groups are not led by a licensed therapist, but just a peer that has gone through whatever the topic is. And they have like 80 million groups. So any topic you could ever want, they have. So that's another good resource. But most therapists do those consultations that I mentioned and can help, if they don't feel like they're the right fit or you don't feel like they're the right fit. They can definitely help with other resources. Therapists tend to know how to find other therapists. So
yeah. Absolutely. No, I think that's great. And what we talk a lot with our clients about, if we're working with a married couple, this has happened in the past, we go over signs and symptoms. But what's so important, and I think what a lot of our listeners can do is, do the things that can set you up for success. So have somebody in your corner, who knows, like, if I'm showing signs and symptoms that look like this, here's who I want you to reach out to. And often that's their doula. And so I've had a lot of husbands send me that text message of, I'm noticing some things. I always say, to the significant other, I'm like, you are my second set of eyes, right? Like you are in that household with baby, with mom. And so they're able to reach out right away, say, hey, this is what I'm seeing. You told me to reach out if we kind of start seeing these things. And then action plan has already started, and we're getting this mom the help that she deserves. And we talked about this just before jumping on to this podcast episode. It is not a reflection of who you are as a person. It's not a reflection of who you are as a mom. It is not something that's within your control or that you're choosing for you or for your baby. And so I think if we can take that stigma off of us as moms and say, there are signs and symptoms all across the board in pregnancy, and you're not choosing which ones you experience. And so why is mental health carried with shame? Rather, it's something that you're experiencing through this journey. And just like any of the other, potential complications, hopefully you're getting help and support for those. And so this really should be no different. And so if there's anything after you are done listening to this episode with Kyler and I'm speaking for you a little bit, but I'm pretty sure she is aligned with this. If nothing else, set yourself up to have that trusted source, whether that's your spouse, your mom, your best friend, who you feel safe with, who you feel like you can have honest conversations with. Let them know the signs and symptoms that Kyler just informed us about so that they can take action when you're not in a position to do so. And getting help for your spouse or your friend or your daughter-in-law or your daughter, that's going to go far beyond holding their baby or buying an outfit. We need to take care of our moms who are taking care of our babies. It starts there. So, thank you for sharing that with our listeners, because I think that is probably going to be one of the most important takeaways, is just dropping the stigma, knowing what to look for, and knowing that there is help available for you. So if a patient reaches out and it is a great fit and they're ready and excited to start working with you, I am sure this is a hard question because I'm sure it's different for every patient. But what does treatment look like? Do you guys decide together how often you're meeting? What does that process look like?
Yeah. So I want to go back just a second to what you were talking about earlier about it affects everyone. So perinatal mental health really does affect every gender. So it can affect partners, um,
Yes.
race, socioeconomic status. It affects everyone equally. So it's not anything like I did XYZ and therefore I have this and it's my fault. It
Right.
just happens. And there's certainly risk factors that
Yeah.
can tell us like, oh yeah, this person might experience this more so than someone who doesn't have those risk factors. But ultimately, it's a guessing game, right? Because someone that has no risk factors and has a perfect life that doesn't exist, they can
Right.
experience these things as well. So,
Absolutely. Yeah.
but yeah, as far as next steps for treatment, it is really a conversation. There's definitely, concerns financially and scheduling and just capacity that people have for treatment. I think that most therapists are in agreement that, weekly sessions are usually what prove to be the most helpful.
Okay.
But that being said, not everyone can do that, and that's okay, right? Especially as a mom, sometimes it's hard to get away for 50 minutes or an hour. And most of us, certainly myself included, welcome the babies. They can absolutely be there, but it can be hard to do therapy and work on yourself when you have another person there as well. And so,
Absolutely.
both and then as far as duration, it really depends. A lot of times pregnancy and postpartum can bring up a lot of things from the past. So if you've
Mhm.
had prior trauma or abuse or things like that, a lot of times during pregnancy, that's going to come up and be something that also needs to be worked through if you haven't worked through it already. And so that can, you may be in therapy a little bit longer,
Mhm.
but that's okay. And it is, really an ongoing conversation. And there are some really great, modalities out there like EMDR, brain spotting, that can really be super powerful, especially in the perinatal period as well. So yeah, really depends.
Hey guys, it's Stephanie Sinclair, founder and owner of How to Mom. I'm just interrupting today's episode to make sure you are well aware of all that How to Mom offers. We, of course, are a community and a support group for all moms at all stages of life, but we also offer a large variety of services that I wanted to make sure you are well aware of. We offer birth doula services, both in person or online support. We have birth support groups with different birth packages to choose from. We also provide placenta encapsulation services, lactation services from our lactation counselors. We also offer postpartum services, birth planning assistance, belly casting. We have a registered dietitian, nutritionist. We also offer a variety of photography services from birth, newborn, and family packages. We truly have it all here at How to Mom. So please don't hesitate to reach out today to have a free consult and help us find the best way to support you in your pregnancy, birth, and postpartum journey. Now back to today's episode. Well, and the other thing too that I think is important, what you mentioned is, through that treatment, if past traumas do come up and different situations that need to be addressed and deserve care and support, I just want to reassure moms, partners, that investing in yourself and working through that really is paying it forward for your child or for your children. I know in the moment we're like, oh, financially or taking the time seems really difficult, or some people even consider selfish, or maybe we're feeling selfish because of, the generation that came before us, maybe it wasn't as accepted to go to therapy. And I just want to reassure all of you that you working on yourself is working in favor for your baby and for your spouse. And so it's not selfish and it's not just for you. I always say happy, healthy mom is able to care for and provide a happy, healthy baby. If we're not taking care of ourselves as moms, that comes out in all of those areas. And so, yeah, I would just urge you to kind of lean into that through your treatment process. If other things come up, that how inspiring that you are dealing with that now versus having it come up in different ways later that might not be as healthy. Um, so I think that was a really important part or a really important item that you brought up.
Yeah, and part of it too, like I see clients outside of the perinatal period too, and we still talk about the perinatal period. Like, what was your mom's life like during pregnancy and postpartum? Because that informs so much of who we become as adults.
Oh,
And
true.
so working on it and having, success and getting treatment, because all of these things that can happen mental health wise are treatable, right? It's not anything that you have to struggle with forever. I just have to get through the first year and then it'll get better, right? You can get better right now.
Yes, I
And
love
then,
that.
yeah, you truly do set up your kids for so much success by working on yourself, not only as being a model of it's okay to need help, but also because you're going to be such a better parent and a better partner if you set yourself up for success in that way as well.
Yes, I love that. Will you tell our listeners a little bit more about your online pregnancy and postpartum group? I believe it's a 12-week group just to let them know that there are other options and support available.
Yeah, so we are still in the process of trying to get that started. Groups are kind of a bear where you need, enough people to get it started. So it's truly a group, but it is really a custom curriculum that I've created.
Okay.
Really going to be, like 12-ish weeks. Just again, so people can have a clear idea of like how long is this time investment going to
Mhm.
be. But it's really meant to be a combination of support just from other people that are going through the same thing. So other, birth givers, other partners, and then also some psychoeducation as well. So education about the different things that come up in the perinatal period. And it's really for anyone that is pregnant or going to become pregnant soon, all the way through like a year to 3-ish years after birth. Just anyone that kind of wants that peer support in a kind of psychoeducational setting as well.
Amazing. And we will have links to below this episode so that you are able to reach out to Kyler. I'm guessing it would maybe be helpful if this sounds interesting to you and like something that could be helpful. Maybe just even reaching out to be put on the wait list for when the group kind of launches. And I just community is so important. And sometimes that does look different than like your friend group or your family. And not only is it great to have a community who's going through similar situations as yourself, but a group that comes without judgment or preconceived notions or expectations. How freeing to be able to have a group where you can be vulnerable and connect and have that community. So I urge you guys, if this sounds like something that could be helpful, beneficial, to just reach out following the link that we will provide here below. That is just amazing. And I feel like that's so unique and something that's not offered enough. And maybe even also helps break that barrier of getting support, but maybe if you're not able to invest in, that one-on-one treatment, or if you're nervous about kind of going into a one-on-one treatment, to just kind of break those barriers and to help these moms or whoever needs that support to take the first step. I wanted to back up just a moment because I know that we talked briefly about your clinic, but I think what's important, and I think what would have been very appealing to me as a brand new mom or bringing home the twins and being kind of head down in the thick of it. The fact that these visits are virtual, I know it feels like, how in the world could I add one more thing to my list when I already feel overwhelmed? And just the fact that this can be a virtual visit where I can head down to my office, shut the door, but I'm not having to take travel time or find a sitter. Maybe I can do it during nap time. I just wanted you to kind of touch on that a little bit more, and what you've heard from your patients of just how much more accessible this is with being able to offer it virtually.
Yeah. So I've been doing virtual therapy since the pandemic started. Wasn't anything that I think most of us therapists thought would be the wave of the future. And
Totally.
now it's here. And I, as a mom, love it because it takes less time away from my own kiddos because of, not having to commute. That drive time is huge, but it is so flexible. Like I see people that are lying in bed, like they don't even have to get out of bed for their session,
I love
which is
that.
beautiful. People that
Yes.
have babies there, or even just for part of it, like their spouse will bring their baby into, like nurse or what have you, and then take them away. And it's beautiful to have that option.
Yes.
Um, I have one mom that I'm currently seeing that has really benefited from just having, like, when their baby is sleeping, having that baby there on their chest during their session, just because of that weight and presence. And again, having that option to not have the baby if you don't want to as well is huge. And
Yes.
I have yet to have one person say, "Are you ever going to go in person?" Because moms just, not that there aren't people out there that like in person, absolutely, but the
Yeah.
flexibility is huge.
Absolutely. It just seems so much more accessible, so much more manageable. And I'm sure you see, like, it's not as easy to put it off, right? Because it's just much more convenient. And I'm sure even in the thick of it during that day, if you're feeling extra tired or you're like, how can I add one more thing? I can only imagine that once your patients get on that call and the conversation starts, they're just like, it's like a workout, right? You're like, I'm so glad I'm here. Like, I'm so glad I pushed through that feeling of almost canceling and just getting on. And then once they hang up that call, they're like just weight lifted, so thankful. Um, so I just thank you so much for the work that you do and the information that you're spreading and the education that just is so needed in our society, and just being able to specialize, I'm sure in itself really helps your patients kind of break down those barriers and just be as real and vulnerable and raw as they deserve to be, because this is not this is not an easy time in our lives. We can definitely have two columns of feelings. We can be thankful, we can be overjoyed, we can also feel like this is really hard. It stretches us so thin. And kind of just thinking about our conversation about generations and expectations, and just like, having this mentality of like, I just have to put my head down and push through, because the ones who came before me, they didn't, go through therapy. And um I often, have this conversation of with clients of, that generation not being educated or understanding, and I'm like, their struggles came out in different ways that weren't as healthy of an option as therapy. So would you like to leave our listeners with anything in addition to kind of all of the great information that you already shared with them today, whether it be about your clinic or perinatal and postpartum disorders, or just any last tidbit about what they deserve and the support that is out there? And they just deserve to be held and supported. And if therapy can be one of those factors to help them through this process, that they deserve to invest in themselves. But anything that you would like to leave our listeners with today?
Yeah, just that every single person struggles as a parent, and that is okay. And it's okay to reach out for support, whether that's, therapy or couples therapy. It also puts a really big strain on relationships a lot of times. And that is also okay. And leave behind the notion of we're just supposed to have this new tiny human and our lives are just supposed to adapt and be 1000% okay from day one. That's not going to happen. And that's okay. It's okay
Yes.
if it takes a minute, and it's
Yeah.
okay to reach out if you need to.
That's amazing. Kyler, thank you so much again for the work that you do. Thanks for sharing today. I urge each and every one of you listeners to reach out, whether it be to Kyler, myself. Let's, have this conversation. Let's drop the stigma. Let's get all of you the support and community that you deserve. So thank you so much for listening. I know this is and can feel like a tough topic. But it is a part of a lot of people's journeys. And so we need to talk about it more often. So Kyler, again, thank you so much for being on today's episode.
Yeah, thanks for having me, Stephanie.
All right, you guys, that is it for today's episode. I hope you enjoyed. If so, please subscribe to our podcast, comment, share, give us feedback. We'd love to hear from you. Thank you so much for taking time out of your day to listen, and we will see you next time.